Okay, and we can get started. So the agenda for today is I'll be going over an overview of Being, the new mental health initiative, the request for proposal overview and objectives. I'll also go through key funding details and eligibility criteria, the scope of work that we're expecting each team to conduct, submission requirements and evaluation criteria, and some tips and key dates. And then we will have about 30 minutes for an open question and answer period. So Being is an international mental health initiative that was launched last week to fund and support research and innovative approaches that improve the mental well-being of young people aged 10 to 24 in low and middle income countries. The initiative is hosted by Grand Challenges Canada in partnership with Fondation Botnar and United for Global Mental Health and Global Affairs. Being will support research, collaboration, and community-based and young people-focused innovations in 13 priority countries. This includes Romania, Tanzania, Colombia, Ecuador, Ghana, Senegal, India, Morocco, Egypt, Indonesia, Pakistan, Sierra Leone, and Vietnam. These countries were selected for their fast-growing urban environments, and they are a special focus of interest for the initiative. Over the next 7 years, Being will seek to create supportive communities and bring system-level change in priority countries and selected cities through a strategic and coordinated approach that combines networks, research, innovation, policy and advocacy, and youth engagement. So the opportunity for collaboration that we have launched includes analyzing local mental health and well-being needs of young people in the 13 priority countries. It is the first request for proposal for this initiative, and it is really research focused. Being is looking for researchers, groups, or organizations based in low and middle income countries to use the relational approach to well-being framework to analyze local information on young people's mental health and well-being. And meanwhile, we also would expect the teams to lead stakeholder and network engagement to scope opportunities for investment and collaboration, which will be the main portion of the work. The purpose of this opportunity for collaboration is to understand the local needs, personal, societal, environmental, and other drivers impacting the mental well-being of young people aged 10 to 24 in the 13 priority countries, to leverage these findings to help determine the next phase of funding and identify opportunities to catalyze change for young people's well-being through consensus building, and to engage organizations, partners, and networks relevant to young people's mental health and well-being at the local and national levels. So really, this research opportunity is the first step of the initiative, and it is to ensure that we understand the local context of mental health in these priority countries so we can determine the next phase of funding and identify where the opportunities are for us to fund in the mental health area in these countries. The objectives of this request for proposal includes to summarize and synthesize available evidence regarding mental health among young people in the identified countries, to identify gaps in evidence regarding mental health among young people and highlight future opportunities, to conduct stakeholder consultation to fill in information gaps and identify priority research and intervention needs, to bring together diverse groups, to identify a mental health agenda with the potential to catalyze change in the countries of interest, ranging from young people with lived experience to relevant government representatives. So really thinking of engaging individuals outside of, not just outside, but beyond the health sector. So the funding opportunity, the geographical focus, if you are submitting a proposal, the proposal should focus on the analysis of available mental health information and network building in one or more of the 13 priority countries. We are only looking to fund proposals that focus on the work in these 13 priority countries. In order for you to be an eligible entity to apply, you must be based in a lower middle income country or be in a partnership with the lead entity based in a lower middle income country. So eligible entities don't have to actually be from the 13 priority countries. Eligible entities that are willing to apply should be based in lower middle income country or be in partnership with one. However, the actual proposal, so the actual research work, should be based in the 13 priority countries. Lastly, the timeline for this project. If you are submitting a single country bid, so you are focused on research in one of the priority countries, it will be a 9 months project. And if you are submitting a multi-country bids, meaning you are going to be conducting research and context analysis in more than one of the 13 priority countries, then it will be 12 months. So eligibility criteria. To be an eligible institution to apply and enter an agreement with Grand Challenges Canada and to be able to conduct this type of work, your entity must be based in a lower middle income country or be in partnership with the lead entity based in an LMIC country. You must submit complete application. So all the required information in the RFP and the request for proposal should be included in the technical and financial bid. The technical bid should not exceed 10 pages, including both the cover sheet and any appendices included. You must submit your complete application in English or French. No other languages will be accepted. And lastly, the eligibility criteria would be the geographical scope, which, just to reiterate, the proposal should be focusing on conducting context analysis and research in one of the 13 priority countries. Next, I will dive into detail in regards to the scope of work. So this opportunity is quite different than what we funded previously at GCC. We're not asking teams to conduct an intervention or an innovation. And we have actually provided the scope of work that we're looking for teams to conduct very clearly in the request for proposal. So while we've provided you with the scope of work, we expect applicants to actually let us know in their application how they are fit and what experience they bring to the table to conduct the scope of work that we've outlined. And there are actually two main components of the scope of work. The first component is, which is about 20% of the work and the time or effort that will be spent on it, is the analysis of available mental health information, which is where you're identifying the available information and then identifying the gap in the information. The second part is the part that will be 80% of the time and effort, and that will be the stakeholder engagement, consultation, and network strengthening. That's what should take most of the time, and that's what should bring in, so it's bringing everyone onto the table, having consensus building, and really filling in those gaps that you weren't able to fill in from the literature search at the beginning. So I'll go into details of that. So the first scope of work is divided into two components. The component one is the analysis of available mental health information. The purpose of it is to collect existing evidence and identify gaps in information regarding mental health among young people. This includes information regarding the well-being drivers of mental health, engagement of young people, mental health innovations, pathways and pathways to scale, and mental health key stakeholders. The overall aim is to use this collected information as a starting point for component two, which will take most of your time. So the outcome of component one is to produce a preliminary country profile and analysis. So visual mapping, we expect teams to develop a local visual mental health ecosystem map that identifies the key stakeholders, the drivers, the services, and relationships and connections between these groups. We also expect teams to produce a gap analysis of available information to identify the gaps in the current information available that may be necessary for moving the mental health agenda forward in these countries. So this gap analysis can be formal or informal, but it will really be the starting point of component two. So moving into component two, which is the stakeholder engagement, consultation, network strengthening. The purpose of this component is to invite key stakeholders from a variety of sectors beyond the health sector and organizations, as well as individuals, to share and discuss their perceptions about the collected information, with emphasis on filling information gaps not available through literature and enriching the available evidence gathered in component one. So really the gap analysis that you conduct in component one, you're bringing in stakeholders in component two and asking them to help with filling in these information gaps. So the convening of key stakeholders will serve as a starting point for connecting mental health networks in the countries of focus. Key stakeholders should include those beyond the health sector to reflect the infrastructure of the country. So the purpose of component two is really to ground engagement and consultation in this process to help determine where and what we should fund in the future and who should be involved in the process. So component two is divided into two parts, 2A and then 2B. The first one, the objective of it, so the first part of component two is stakeholder engagement and consultation. The purpose of it is to convene stakeholder groups to better understand collected materials and gaps in information from component 1. This objective is meant to build on and expand on evidence gathered in component 1 with additional information not available through literature. Context-driven research questions of interest to public sector partners should be identified at this stage, as well as existing and new ideas for mental health innovations that could be scaled to improve the effectiveness of mental health programming going forward. The second objective is to gather insights from key existing mental health stakeholders regarding their interests, expertise, readiness to take action, and willingness to collaborate with other stakeholders to move the mental health agenda forward. So the outcomes of this portion will be a midterm report, which will consist of stakeholder perspectives on existing evidence and gaps in knowledge, and stakeholder interests, expertise, readiness, and willingness to take action and collaborate with other stakeholders. The second part of component 2 is the network strengthening, which should take the other 40% of this time. So key stakeholders will determine how to best strengthen existing networks and collaborate to develop and nurture community and leadership support for addressing mental health issues in the country of focus. More specifically, the team will facilitate consensus building among key existing stakeholders by supporting lead stakeholders. Hi there, I believe my Zoom just restarted, so I do apologize. Just give me 1 second while I figure out. Deb, would you be able to tell me where I left off?
It's okay, thank you.
Yes, you left off on the component 2B SWOT, so maybe I can just pick off from this slide. Yeah.
Yes, for sure. Apologies about that. My Zoom completely restarted. Okay, so I can continue this and the recording is on. Apologies again. So component 2B is network strengthening. So key stakeholders will have to determine how to best strengthen existing networks and collaborate to develop and nurture community and leadership support for addressing mental health issues in the country of focus. More specifically, the team will facilitate consensus building among existing key stakeholders by working or supporting lead stakeholders engaged in the mental health field already to identify priorities for research, innovative interventions, and initiating and catalyzing change. Consensus building may occur in a variety of ways and use various approaches, such as the Delphi method, surveys, and other tools that may be employed to facilitate the consensus building process among stakeholders. So the objectives of this is to consult with key stakeholders to assess and prioritize needs, barriers, and steps required to catalyze change. Some areas to consider include forecasting needs and opportunities, and future opportunities and recommendations. The outcome of this portion is to develop consensus building outcomes. So really highlighting pressing current and future needs and opportunities, priorities, next steps, and how to best disseminate identified recommendations. So really we're looking for, the second component is really about strengthening the current network that exists in the specific country, facilitating consensus building among the key stakeholders that go beyond the health sector, and really identifying where the funding should focus on for the next phase of this initiative. So next we'll move forward on the submission requirements of the application. So there are two parts to your application that you should submit. The first is the technical bid, which should demonstrate an understanding of the requirements described in the bid solicitation, as well as demonstrate how the requirements of the evaluation criteria and basis of selection will be met, which is described in Appendix B of the request for proposal document. The technical bid should not exceed 10 pages, including the cover sheet and any appendices. The second part of the application should be the financial bid, in which you should submit a financial bid in accordance with the basis of fees in Canadian dollars, and the total amount of any taxes should be shown separately. Other mandatory criteria that should be included in your bid as part of the technical or financial bid is the basis of fees, history of the firm and location, description of support team, description of support processes, 2 client references in which we just need the contact information and not the actual supporting letters. And lastly, any value-added services that you think would be valuable to add to your proposal to make your application more competitive. If we move forward to the evaluation criteria, which is also identified and clearly outlined in the request for proposal. So this is how each application or bid will be scored. Bids will be scored on 3 different areas. The first one is experience, which is worth 40% of the overall score. This is whether the bidder outlines relevant functional, technical, sectorial, and geographical expertise to be able to meet the scope of work outlined in the request for proposal. Next, each team will be assessed based on fees, so whether the scope of the proposed work and funds requested are reasonable and aligned with proposed goal. So the amount for each of the award for this will be approximately 150,000 to 250,000 Canadian. However, this could vary based on whether the bid is single or multi-country bid. Lastly, each bid will also be scored on ability to achieve program goals. So whether the proposal shows strong feasibility to achieve key deliverables on schedule and engage relevant stakeholders, including youth, public, and private sector, and deliver final research outputs. So this is where we would really like to see how your team is fit to conduct the type of work and the scope of work outlined in the area, in the focus area you are submitting for. So I'm just going to go over a few points in terms of what would make a successful application or stand out. So a successful applicant will demonstrate the following. They'll demonstrate functional expertise needed to accomplish the deliverables. They will have to demonstrate technical expertise needed to accomplish the proposed deliverables on youth mental health in the specific area. They will have to demonstrate sectorial expertise needed to demonstrate understanding of local and national stakeholders, strategies, and developments within the field. They need to also demonstrate geographic and location-based expertise necessary to accomplish the proposed deliverables in one or more of the focus countries. A successful applicant will have to show an understanding of global and local external stakeholder strategies, developments within the mental health field. They should demonstrate previous experience working effectively within complex governance structures, along with in the area of mental health or research. And a successful applicant should demonstrate capacity to deliver objectives in an effective and results-driven manner and show clear management and accountability structure within the team. The successful applicant should demonstrate strong feasibility to move forward the key deliverables on schedule, including ability to engage relevant stakeholders, including youth, public and private sector, and deliver final research outputs. They should be able to show understanding and plan and a clear plan of how they plan to conduct the key activities needed to achieve key deliverables. They should also demonstrate value-added services that will help achieve proposed activities and deliverables to help the mental health initiative achieve its goals. And they should also lastly demonstrate clear engagement of relevant stakeholders, including a specific focus on people with lived experience and young people with appropriate safeguarding mechanisms in place. So next we'll move on to some of the tips that we have put together for yourselves while you're preparing your application. So first and foremost is to be sure to review all bid requirements in the request for proposal. So ensure that all items requested are actually submitted. Demonstrate and ensure that you demonstrate understanding of statement of work, required deliverables, and timeline that's outlined in Appendix A, and ensure to include all components of the scope of work in the proposed plan, along with a description of how each component will be conducted. Next, in terms of the format, we strongly recommend that you use subheadings to help reviewers identify what area you're speaking about. Are you speaking about how you're going to meet the deliverables and the timeline and how you're going to conduct the scope of work? Or are you focusing more on the experience that you bring to the table? So using subheadings will make your application a lot easier to follow and understand where, like, the different areas that you're trying to cover. And in terms of format, you cannot exceed the page limit of the technical bid, which is 10 pages. Your application will not be reviewed if it exceeds 10 pages for the technical bid, which does include the cover letter and any appendices. Lastly, in terms of the financial bid, You must ensure that estimated fees are in Canadian dollars. So the total amount of any applicable taxes should be shown separately. And we do ask that you provide hourly fee for personnel involved. And your indirect cost should not exceed 10%. So moving on to the timeline. So the application deadline is coming up shortly. It will be November 17th, 2022 at 5 p.m. Eastern Time. We will conduct eligibility screen and review process in November, and then we will start negotiations with successful applicants between November and December of 2022. The anticipated project start date would be January 2023. So we will be able to share the links for all of these. So the reference documents, the actual request for proposal document that's available in both English and French. And then we also have an FAQ document, which we can add any questions that are also asked today that haven't been answered in the document. That's also available online in English. And we also have a recording of this session available online from last week, but we will also be able to share this week's recording. And yeah, so that's it for the presentation and the information that we've had to present for you. So